Hi, this is Dr. Dumestre, board certified plastic surgeon. Thank you for this question. So this is a very common concern in patients wondering if they fall into the BMI category of obese. Are they going to be a candidate for the DIEP flap reconstruction, which is that longer surgery transferring your own fatty tissue up to your breast to reconstruct them after cancer? Now, a DIEP flap reconstruction in my heavier patients or obese patients is actually a really great option. Often implants don't sit quite as well. You can't sometimes get the volume that you want, and we tend to have a little bit more complications with them. That being said, there are some increased risk factors with obesity and the DIEP flap reconstruction, but often does not preclude us from performing it. So the biggest factor is, how is your general health? Are your comorbidities under control? If you're a diabetic, is your hemoglobin A1C under 6? Is your blood pressure controlled? Do you have a history of cardiac disease? So I want to make sure that you're healthy. Assuming that your medical conditions are under control, then I'm perfectly happy proceeding with DIEP flap reconstruction, even in patients with a BMI over 35. Now, looking at this study by Fisher et al., they looked at the complication rates in different obesity groups as BMI class went higher, and they found that there was a significant increase in minor complications. So about 50% of the patients had minor complications, which are mostly wound breakdowns, small fluid collections, and then major complications, which would be flap loss, so you lose the entire tissue transferred, or a big hernia, and that rate was about 8% for both. Now, the complications that they found increased the most were wound healing complications, and that's especially after an immediate DIEP flap. There's two different types of flap loss that can occur. One is your mastectomy flap. So the shell of your breast, after the breast tissue has been removed, you've lost the blood flow that's flowing through the breast gland to supply that skin. So mastectomy flap necrosis is the first type of skin death that's related to the actual removal of the breast gland. And that rate is a lot higher in my heavier patients. Also, then there's flap necrosis, which refers to the filling of the fatty tissue that's in the breast. So total flap loss was still quite low. There was an overall 98% success rate across all obesity classes for the free tissue transfer. Now, rates of partial flap necrosis, or areas that don't have as good of blood flow and respond by getting firm, was a lot higher in the higher BMI groups. Hernia rate or abdominal weakness was also quite a bit higher in my heavier patients, and just speaks to the use of mesh or a reinforcing agent to help with abdominal strength after this type of surgery, and also being extra mindful to do it as muscle sparing as possible, which we do anyways for all of our patients. There's increased time during the surgery. It just takes longer to dissect a bigger flap. Increased blood loss, again, just bigger surface area, and sometimes increased hospital stay. Major complications like death were pretty much non-existent, and clot risks such as deep vein thrombosis or pulmonary embolism is still around the 1% to 2% rate, so it's quite low in general. All that to be said, DIEP flap is a wonderful option in my heavier patients. It does carry some increased risks. As long as you're willing to assume those, then it can still be a really great option for your ultimate reconstruction. Have a great day.